Welcome to Aetna Better Health of Louisiana. If this is a life-threatening emergency, please hang up and dial 911. All calls are monitored and recorded for quality assurance purposes. If you're a healthcare provider, press star. If you know your party's extension, press 0. Otherwise, please stay on the line for further information.
Para español, marque el 8.
What can I help you with? Say eligibility and benefits, ID card or welcome packet, case management, nurse line, transportation services, mental health crisis support, or more options.
Case management.
I didn't get. Transferring you now.
Your feedback is important to us. After speaking with a representative, please stay on the line to complete a brief survey regarding the service you received today.
If you need a ride or wish to speak to transportation, press 1. If you would like to speak to a member service representative regarding all other questions, please press 2 or remain on the line.
Thank you for calling Aetna Better Health of Louisiana, where your health is our priority. Speaking of your health, have you downloaded the Aetna app yet? The app allows you to find a provider, check if they offer virtual services, see where they are located, and much more, all within the palm of your hand. If you can't download the app, a member services representative can help you locate a provider that meets your needs. You can also go to the Aetna website and use the Find a Provider tool. Aetna wants to remind you to schedule your annual exam, an important first step towards staying healthy.
Good afternoon. Thank you for calling Aetna Better Health of Louisiana. This is Nita. There will be a brief survey at the end of the call on performance provided to you today. How can I help you this afternoon?
Hi, I need to set up mail order pharmacy.
You need to set up a new order of pharmacy?
Mail order pharmacy, like just whatever the I was told by my doctor to call y'all. And then get the preferred mail order pharmacy provider for like a pharmacy that does mail orders as their only thing. And then refer through them to my doctor's office to then get a larger quantity of medication at a 90-day supply. As I've been having a lot of difficulties getting my medication, it runs out today again, and I'm supposed to be on a 90-day supply of it and not a 30-day supply of it. I don't know why it's on 30 days. I've gotten 90 days from y'all before without problem. That's how it started, so we need to get back to that as a schedule because it's for epilepsy.
What is your member ID number?
My member ID number is 579-403-864-5696.
And what's your name and your date of birth?
Jeffrey Thomas Bodin, date of birth 05/22/97.
And verify your full address and phone number?
My address, I don't know if you guys had it updated yet. I've updated it with some parts of Aetna, I guess. I'm not sure with y'all. Is 406 Parkview Boulevard, Mandeville, Louisiana, 70471. My previous address was 528 Beauchene Drive, Mandeville, Louisiana, 70471.
What was your new address? 406 Port who?
406 Parkview Boulevard, Mandeville, Louisiana, 70471.
All right. And what about your phone number?
My phone number is still the same, 985-520-4713.
Now, is this your new mailing address and physical address?
Yes, I guess so. Yeah, I've transferred. I had my mail's been transferred so far with the post office to this address. So I've been getting stuff
Okay.
here, maybe just delayed, or significantly delayed. So yeah, I'd say this is my new mailing address as well.
And do you have an email, Jeffrey?
I should still be the same email on file. JEFFREY BODIN 713 @gmail.com.
And I show that your primary is Callie Linden. Is that still valid?
Yes, ma'am.
Okay. So as far as the mail order, Aetna doesn't have a process where they have mail orders to our members. That's up to the pharmacy. If they have some type of ability to have mail orders come to you, then you would go through them, not Aetna. For the Medicaid side, they don't have mail order prescriptions. Now, you can speak to Magellan, who is our pharmacy vendor, to see if they have any information on mail orders. Would you like for me to transfer you there?
Yes, ma'am.
All right, if you'll hold just a second, I'll try and get them on the line. Just one moment.
We have a new interactive voice response system. Please wait until the prompt has completed your response and speak clearly so we can better assist you. Thank you for calling. Which are you? For member, say or press 1. To continue in English, say English. Para
English.
español. Sorry, I didn't understand that. Which are you calling about? PA, status, new prior auth, claim inquiry, eligibility status, web support or something else?
Something else.
Say the member ID, or say I don't have it.
579-403-864-5696.
Say the member ID, or say I don't have it.
579-403-864-5696.
You said 5, 7, 9, 4, 0, 3, 8, 6, 4, 5, 6, 9, 6. Is that correct? Say
Yes.
yes or no.
Yes.
Please say the member's date of birth. For example, you can say February 19th, 1989.
May 22nd, 1997.
One moment, please. Say the member's zip code.
70471.
Please hold while your call is transferred. To ensure quality service, your call may be monitored and recorded. Please stay on the line after talking to the agent for your brief survey. Your feedback is very important to us.
Thank you for calling Louisiana Medicaid Pharmacy call today. This is Brittany, clinical pharmacy technician. How can we assist you?
Go ahead, Jeffrey.
Oh, hi. I need to access a pharmacy that has some capacity through Medicaid to give me mail orders of some sort, like to where they could fill the prescription, then somehow mail it to my house, so that I can ensure I have a specifically 90-day quantity of my medication for epilepsy that runs out today.
Okay, I'm happy to take a look at your benefits, Jeffrey, and see how I can assist. May I get your last name and date of birth?
Bodin, date of birth 05/22/97.
All right. Thank you so much. And you said this was concerning epilepsy medication?
Yes, ma'am.
Okay. Which medication was that?
Valproic acid capsules, 250 milligram.
Okay. And do you mind if I just get a good callback number in case we're disconnected today?
Yes, ma'am. That's 985-520-4713.
Okay. All right. So Louisiana Medicaid doesn't have a specified mail order pharmacy. It just has to be a participating pharmacy that's within your pharmacy network. And I do see here that you are restricted to a maximum of a 31-day dispensing.
What's a 31-day distance?
The most that they can dispense at one time is up to a 31-day supply.
Is there a way for you to change that? Because in the past, I definitely received a lot more than 31 days of a supply.
So prior to July 1st, they were allowing maintenance medications to auto-adjudicate for 90-day supplies. On starting July 1st, they do want the member to have at least 2 30-day dispensings within a 70-day window to show compliance, and usage for maintenance medications before they'll pay for that 90-day fill. I see a claim on 7/29. I don't see one for August.
Well, that's because the one on 7/29 was the last one, I guess. I didn't get it filled until, it didn't get filled until, 2 or 3 weeks into August, so. Actually, I ordered it before 7/29. I ordered it, 2 weeks into July, not having the medication, and then it took that long. And I was having seizures and things, and I reported that to my doctors, and they were very concerned about that. So there was a delay because of Medicaid in this case, and not just the pharmacy.
Not that I'm aware of. It looks like the prescription that they processed back on 7/29 was an initial fill, and it was a prescription written back in February. So I don't see that they were waiting on necessarily
so the pharmacy just waited and twiddled their thumbs and didn't do anything. Okay.
Yeah, and I do see they had an origin code of 5, which means it was a transfer. So I'm not sure if they transferred this medication from another pharmacy prior to that.
No, they've been the only pharmacy I've filled it at.
But I do apologize. If you were to fill it for that, it looks like there is one refill authorized. So if you were to fill it for August and show that 70 days of compliance on that third fill, you'll be eligible for a 90-day supply. But we don't have a dedicated mail order team.
Okay, can I transfer that prescription to a different pharmacy, or do I have to get it filled at that same pharmacy?
You would have to transfer it. You can fill it. They have it on record. I do see that it's been transferred one time, so I'm not sure if there's any, state laws. It's not a controlled medication, so they should be able to transfer it to any other network pharmacy of your choice.
How do I do that?
But, of course, that's your preference. You would have to contact the pharmacy you wish to use and provide them with that information for that Walgreens, and they can call over there and transfer those records.
Do they just transfer it by calling or faxing? What happens with that?
They can actually do it either way. It's really at the discretion of the pharmacist, depending on how busy they are. Some will, call and request that information, and the transferring pharmacist will just provide that verbal information over the phone. Some like to print the records and actually fax over maybe a hard copy of that prescription or a profile print of what they had on record for you. It can be done either way, but that's at the pharmacist's discretion.
Okay. Just in case I need to call y'all again, what's a number for y'all as a clinical pharmacy technician at Magellan? what do I call to get to y'all direct? Because I've spoken to Magellan before, but I think I called through y'all's website. After being directed there by by Aetna, what's like y'all's department's number, just in case I need to immediately call back?
Yeah, I can give you our direct number. Our direct number here is 800-424-1664. And there is a website. I'm not sure if it's what they previously provided, but it's LAMCO, PBMpharmacy.com. And you're able to look up a zip code, for your local pharmacies in your network, as well as filter by, maybe home delivery. Not necessarily mail order, but they deliver to the home, compounding pharmacy, 24-hour pharmacies, anything that meets your needs. But it is all online for you if you'd like to take a look at that.
Okay, so, and it's LA dot or LAMCO with no, delimitations?
Yeah, no dots or anything. It's all just kind of jumbled all together. LA, like this abbreviation for Louisiana, MCO, which stands for Managed Care Option, and then PBM, which is Pharmacy Benefit Management, pharmacy.com.
LAMCO PDM pharmacy.com. That's it.
Yes, sir. Yep, that's correct.
Okay. Since I have you on the line, is there a way to ask any questions about also another medication that does treat part of my epilepsy and my narcolepsy, which is involved with my epilepsy, that I've been having a lot of issues with lately has been the stimulant I'm prescribed, the Adderall. There's been a lot of problems in the last few months with that. Are you able to pull my records for that and see, if anything can be resolved on y'all's end, or if there's any, immediate errors or something that come up? Because it's kind of just gotten to the point where it's a massive issue, and I had to contact my physician over the point of a week last month, and I've already gotten a judge to order that I have to be on the medication because of the epilepsy and the narcolepsy, and the pharmacy was deciding to potentially not fill the prescription just because they didn't want to, and if they had it in stock, they decided against that eventually. But just having to say that to me is kind of just not okay, and my doctors were not very happy about it, and it had happened before, and that's happened with that Walgreens that you pulled the records for too. I basically can't get it filled there anymore because of issues they have been presenting. So I'm just wondering if there's, since you seem to have more access to my pharmacy records with Medicaid than anyone else I've ever spoken to, if just something comes up, I guess, that would be helpful to give to them to just fix whatever problems they're having in their system that causes them to not want to fill my prescription anymore, even though they filled it for half a decade, and it just not make much sense. Is that something you can handle?
Yes, yeah, I do see your claim history here. I see, unfortunately, each pharmacist, their license is on the line, so they do have that personal discretion. A lot of times we see that more with independent pharmacies, not necessarily the larger chains like Walgreens, but it is universal. It can happen anywhere. I'm not sure as to what the specifics or their reasoning is. I do see that you have the multiple strengths between the 10, the 15, and the 30 historically. So they're just, the only messages that they're getting restricting from the pharmacy is a therapeutic duplication, which is just a drug utilization review, which we just prompt, therapeutically speaking, just to make sure that the pharmacist is utilizing. That way there's no duplicate therapies, things that can be maybe excessive or, just dangerous. It's more of a safety precaution that the pharmacist has to overview.
Are you able to
so it might just be
that because I could fax you the judge's judgment? Because the judge overruled the state having issues, I guess, and the state paid for the judge to do that, like through Aetna and their legal
I
team.
mean, unfortunately, there's contracts and things involved as far as, like legal FDA approvals for these limitations. So I'm not saying that
Well, no,
judges'
it was a
discretion
federal
isn't valid,
judge,
but
and
there is
that was
other
why it was a
safety
big
precautions
issue.
just based on systemic
It was
level.
it was something like the safety precautions, like you're mentioning, for most people, appear to be legitimately causing an unsafe clinical environment for me, as a matter of fact, because not having the medication and having seizures because of it would obviously be an unsafe environment for the patient, and not dispensing a medication in that environment would be a homicide. And I don't really want that on the pharmacists, but I don't really understand what my options are to be in the future if every pharmacy in the area sees that error message as a safety message and doesn't just disregard it, knowing the documented history, having it being proven in writing, having the judge's judgment being sent to them, etc., etc. It'd be no different than any of my other physicians ignoring my history of terminal melanoma and not acknowledging that status and what comes with it with normal triage, and the patient expiring because of it. It would still be on them, and in a very glaring way. So like I is there a recommended option for me to like remediate their errors of actual judgment for their license in order to allow them to keep their license without necessarily getting the law enforcement to immediately disregard any of my preferences of like, I prefer to not have less pharmacists in the area who will fill my prescription, and don't go after them for homicide immediately. Just like, if I had to posit it as something, let's say that was the circumstance, just for no real reason.
Well, I mean, that's a pretty blanket, assumption. I personally, I believe, everything is followed according to their training of FDA approval, dosing, and limitations. I do understand you have a unique case as far as medical necessity, and of course your health is very important, to you and us. As far as, establishing a protocol, we can't remove drug utilization reviews. Those are required by law. They're for safety for all members and patients. It doesn't mean that there isn't special exceptions, but they are documented based on medical necessity and any information that is provided to support that request. So,
how do I establish
I think
that? Like
the best option is to
that special exception, because I'm pretty sure Aetna already established it, but just in case they didn't, and for some reason the judge's judgment isn't on file in that, or like is on file, but for some reason it's not popping up in your system on file or something like that, because I'm assuming that would have immediately been there. Do you know of like the way that I would initiate that process to establish the special exception?
That would be something you'd have to discuss with your doctor. As far as a judge's a warrant for that necessity, that's not going to be something that's automatically sent to the insurance company. Of course, there can be copies of court records or transcripts that can be faxed into supporting medical necessity, any sort of propaganda or case-by-case evaluation. But I think your best bet would just be to talk to your doctor and really establish a personal relationship with a pharmacist that kind of understands your unique needs.
I mean, that was already done.
I'm not sure if there's
Aetna, nurse practitioner was there during the administrative law hearing through the whole process. Other Aetna staff were there as well, and so were about 6, 7, or 8 state representatives alongside some other physicians, I think, and some other stuff who were just there as like clerical personnel, I believe. It was quite a lengthy process. I don't really understand how they wouldn't have it in Aetna's system, because Aetna's acknowledged it in their system that I've had a successful like ADL review process and then like re-review process and stuff, because the judge had to judge that the process wasn't being followed to her orders, which may have been the warrant that you were talking about. And then after that, she administered orders on like a federal level, and then things just stopped being as much of a problem because it was about coverageability at that point. And Aetna didn't support not covering the medication. Obviously, they were paying to bring it to court to make sure that I could have the medication covered, because that's their job, and they were probably paid by the feds to do it. And I don't have any complaints about that process, really. But it's just like now there's some sort of an issue with the pharmacists having this license on the line, and I don't somehow the very lengthy extent that I guess on everybody else's end has been finished. They're now impeding the process at even when they have medication to dispense. It's like they're acting like they have no culpability in directly ignoring triage of a patient when they have that personal relationship of documented years and years of filling the same medication, like in July filling the medication, and then in August deciding they're not going to fill the medication and forgetting about it in July, or like in June, the pharmacist at Walgreens forgetting that she filled it in May, and then I have to be sent to a different Walgreens pharmacy in a town over, well, 2 towns over really, in Abita, in order to fill the same prescription. And they both pharmacists from Walgreens in June were able to see the 27 year history with Walgreens, or actually probably a little bit older than 27 years, since my medication dispense from Walgreens started before I was born, at the one that is the one on y'all's records that you pulled the records for the valproic acid, same location. So I kind of think that I exceed to a very unreasonable extent the like personal relationship part. I've been here longer than every staff member at every single Walgreens in the area, and they all know me. I got my chemotherapy dispensed from there. It's impossible to have like a barrier of my like special circumstances if they're not met. I find it very difficult to if I don't have a way to go and process something with y'all, because I've already done the thing with my doctor, and my doctor's really, really done with even speaking to the pharmacy, and they've already called law enforcement in the past many times because of how suspicious it is that multiple pharmacies have been kind of pulling this when it's me that they're speaking of. And that might just be because it's me, but I'm kind of that exception of a patient. For this area, it just kind of looks extraordinarily suspicious for me to have problems. Like it's just a crime being committed. And I understand that. And it's kind of... So if there's anything else you can think of, even if it's like obscure, but like could be something the patient has to initiate, I mean, I could just try it and just see if maybe like you said, the records didn't get forwarded or something, and I'd be happy to do that. I don't really think that some of these personnel deserve to go to prison, but like I don't know what the next step might be if I have to call in and tell my physician that I didn't get my prescription this month, if that makes sense.
Right. Well, I mean, if that's where you're at personally speaking and you feel it's a personal bias, you would have to seek legal counsel as far as a lawsuit, because as far as a pharmacist's license on the line, they do reserve the right to refuse any prescription for any reason. So if they don't feel comfortable filling that prescription based on the limitations and the FDA maximums and the training and, basically their education, that's something they personally don't feel comfortable with. That's not necessarily a crime, even though you feel that you're being judged based on a bias. I mean, the only thing I can
even
do
if the
is
patient
behavioral
comes
health
to
medication.
harm because of that, it's still not a crime.
Correct. You would have to prove that it was a personal bias, that they were seeking malicious intent, because they have that personal right, in defense of their license and their training to refuse anything they don't feel comfortable filling.
Now I'm seeing why law enforcement really kind of gave me an
medication.
attitude if they didn't give a shit. That makes a lot more sense now. If that really is the circumstances, it makes a lot more sense. Okay. Do you know like who I could talk to for the pharmacy board then? Because that's probably who I do. I don't have any intention of bringing a civil suit for something that's not appropriate to sue for fiscal matters of harm. For that's not appropriate in this extent. But I do know that issues with a physician's license, you call a board of supervisors for a medical examiner. Is there something like that for pharmacy in the state of Louisiana?
Yes, there is. I mean, I'm just resorting to Google, so take everything with a grain of salt. But there is the Louisiana Department of LA.gov.
I thought that there might be something you like know off the top of your head. I didn't mean I can find something on Google, but it was the Louisiana Department of Pharmacy in general, just that.
Yes, Louisiana Department of Health. The same website that you would apply for Medicaid. And there is a file a complaint, section of that where you could file a complaint to any healthcare provider, which would include pharmacies.
Oh, what? Okay. Then I'll just use that. I've spoken to them before. They'll be fine.
Okay. And then as far as another pharmacy suggestion, I would possibly inquire with Genoa Healthcare, because they are specialized in behavioral health, and this is a medication that fits in that category. So they might be a little more open-minded as far as dosing regimen and things of that sort.
Genoa Health, okay, healthcare. So they're like, they're just are they a physical pharmacy location?
And they have yes, they are a physical pharmacy. Sometimes they're partnered up with different behavioral health facilities, so I don't have specific information, but I do have their address and phone number.
Okay, I'll
and this is something that they specialize in. It's 985-231-0237.
Okay. And what's their address?
It's 900 Wilkinson Street, and their office is Suite P as in Peter, and that's Mandeville, LA 70448. It looks like it's about 4 miles from the address we have for you.
How do you spell Wilkinsons?
Wilkinson.
Okay. Wilkinsons. Sorry, what was it after that? Suite, or was it drive or something?
Street.
Oh, street. Oh, my bad.
No, you got it right. Yep, it's street. STREET.
And then it was suite what?
P as in Peter.
Sweet P. Oh, okay. Sweet P, Mandeville, Louisiana. Okay. Do I need to update my address with you guys too? Because I live like basically at the same spot almost, like across the highway. But my family bought a new piece of property, but we still have the old address, and I'd want to make sure that my address on file with y'all doesn't cause any issues with medication. So can I update that?
If you've updated that with Aetna, it'll update in our system within 24 hours. But we
okay.
don't do anything as far as your demographics. It's whatever Louisiana Department of Health has, when you apply for benefits.
Sure.
And it is important to make sure you notify them as well, so you'll receive any renewal notices.
Should I wait 24 hours to try to fill my prescription that I needed to fill today, for that update to occur? Because I think I just updated it right before I spoke with you, and I want to make sure that that's synchronized.
I mean, if you prefer to, you can. You're not mandated to, but if you,
okay. If I'm not mandated to, then it's fine. It'll probably be all right. I just wanted to make sure it wasn't going to be like a, something you've probably dealt with in the past as a significant error. If it's not mandated, it's okay. It probably won't be an issue. Okay, I'll contact Genoa and the LDH then. Thank you for your time.
You're welcome. So is there anything else I can check for you, Jeffrey?
Nope, that's it.
Okay, well, thank you so much for calling, Mr. Bodin. It's going to prompt for the survey. Hope you stay well.
Okay, thank you.
Your response on the service you just received is very important to us. How likely are you to recommend us to a friend or colleague? Please say a number between 0 and 10, with 0 not at all likely and 10 extremely likely. Has your reason for calling today been resolved? Please answer by saying yes or no.
No.
Based on your interaction, how satisfied were you with our agent who assisted you? Please say a number between 0 to 10, with 0 being not at all satisfied and 10 being very satisfied.
10.
Overall, how would you rate your prescription drug plan? Please say a number between 0 and 10, with 0 being poor and 10 being excellent.
10.
Thank you. Your response will help us ensure we meet your service expectations. Goodbye. Your feedback helps us improve. Please answer all 5 questions using the numbers on your telephone keypad. You'll have an opportunity at the end of the survey to leave us a voice comment. Let's get started. Thinking about the representative you just spoke with, please rate your experience. Choose any number between 1 and 5. 1 means you strongly disagree, and 5 means you strongly agree. Remember, the higher the number, the higher the rating. I was satisfied with the service I received today. 5. Strongly agree. The representative was easy to work with. 5. Strongly agree. Now, thinking about this call using a scale of 1 to 5, with 5 being very likely, how likely are you to recommend us to others? Very likely. Is this your first call regarding this inquiry? Please press 1 for yes and 2 for no. I see you've called more than once. Was this representative able to resolve your request? Please press 1 for yes and 2 for no. We apologize that we were unable to resolve your issue today. Please tell us what we could have done better. We would love the opportunity to get it right. To leave us a voice comment, press 1 on your telephone keypad and wait for the tone. When you are finished, simply hang up.
Oh.
We appreciate your feedback. Thank you for calling. and have a great day.